Pain and the resulting break are the main problems of patients with knee osteoarthritis. Here, we propose the lower body positive pressure treadmill intervention protocol, which includes both clinical assessment and treatment models for the rehabilitation of lower extremity motor function in knee osteoarthritis.
The LBPP treadmill protocol allows people to achieve exercises with relatively low heart rate, blood pressure, and oxygen consumption, so it is safer and more effective than full-weight exercises for knee OA patients with cardiopulmonary disease.
Visual demonstration of this method is critical for safe operation of the LBPP training system and understanding of our protocol. Demonstrating the procedure will be Dr. Junjie Liang, Dr. Jiang, PT Hongxin Chen, and Dr. Shijuan from my lab.
Begin the clinical assessment by asking the patient to describe their pain intensity from 0 to 10, where 0 is no pain and 10 is the worst pain. Then conduct the active-passive knee joint range of motion assessment using a handheld 2-arm goniometer. Then conduct the Western Ontario and McMaster University's Osteoarthritis Index, or WOMAC, by asking the patient to mark the corresponding position of pain or limited function on a straight line for 5 pain-related items, 2 stiffness items,